For today, I'll be starting with introduction to midwifery. I'll be introducing midwifery to you by telling you the definition of midwifery, definition of a midwife, scope of midwifery, the qualities of a good midwife, objectives of midwifery, and the importance of midwifery. To begin, definition of a midwife. I'll do a normal definition and definition by WHO, that's World Health Organization. Normal definition says midwifery is a branch of healthcare. It is a branch of healthcare. It deals with the care of a woman during pregnancy, labor and delivery, after pregnancy, as well as the care of the newborn. Also, it deals with health education. You must educate the woman, nutritional health education, hygiene, etc. Health education, counseling, family planning services to both the woman and the family. WHO definition of midwifery. According to WHO, midwifery is a skilled, knowledgeable, and compassionate care given to women of childbearing age, infants or newborn, and their families across a continuum from pre-pregnancy, pregnancy, birth, postpartum, and early weeks of life. WHO definition is so precise because it says you must be skilled. You must be skilled as a midwife. You must have that knowledge in terms of practice, because you are not dealing with one life. You are dealing with more than a life. A pregnant woman can be carrying a child, could be twin, could be triplets, it could be quadruplets, and so on. It could be even up to 10 babies. So you are not dealing with one life. You are dealing with more than a life. Even if you are dealing with one life, that life is very important. Come to talk of two lives, as a midwife, you must be skilled in terms of practice. You must be knowledgeable. You must have every knowledge concerning midwifery. You must have it as a midwife. You are a specialist. Midwifery is a specialty in nursing. So as a midwife, you are a specialist in the care of a woman and her child. And the last thing, you must be compassionate. Compassionate because a lot of things can go on during pregnancy, mostly during labor and delivery and after delivery. Those can increase mortality and morbidity rates. It can also decrease it. So being compassionate is a must as a midwife. Wherever you are, here in Nigeria, abroad, you must be compassionate to your patients. They said compassionate, knowledgeable, and skilled, so you can give care to your clients or to your patients. Pre-pregnancy, it means before the woman gets pregnant. Pregnancy, during pregnancy, you call it antenatal visit, like our normal visit. During pregnancy is antenatal. It's also antepartum. During pregnancy, antenatal, antepartum. Labor and delivery. Labor and delivery, that's the birth. They call it intranatal or intrapartum. After delivery, postnatal or postpartum or puerperium. The midwifery name or the medical name is puerperium. Puerperium is from the delivery room once you've expelled the placenta and the membranes, which is the third stage of labor. After you've expelled the placenta and every other membrane, you enter the fourth stage of labor. From that first stage of labor, even while in the labor ward, puerperium has started. When I get to that place, I'll teach you about puerperium. There's immediate and there's subsequent. So puerperium has started. That is the postnatal, means after delivery. You can call it postnatal, you can call it postpartum, you can call it puerperium. Then, care of the newborn. Care of the newborn, because I said pre-pregnancy, pregnancy, birth, then the newborn itself. The newborn, you must know how to care for them. Very, very important in the postpartum. Caring for the mother and the newborn. Early weeks of life, very important. Neonatal, that's what they call them, neonatal. From the time you give birth to them till the 4th week. Some will say 6 weeks, but it's mostly 4 weeks. The first 4 weeks of a baby is the neonatal stage. After that, everything from the beginning of 0 day of birth till 1 year is infancy, infant stage. But from that beginning of birth till 4 weeks, neonatal stage. And that early weeks of life is very, very important. So as a midwife, you must care for the woman and her child as well as her family. Now let's go to definition of a midwife. Who is a midwife? As a registered nurse, you are a nurse. If you've not gone to a midwifery school and you've not written your nursing and midwifery council exam on midwifery, pass and given license, you are not a midwife. A midwife is someone that have been trained in a midwifery school, either college or university. You have been trained, you've passed your nursing and midwifery council exam, and you have been given the license, professional license. I said professional because some, what do they call them, auxiliaries, they'll tell you they have license, they have certificates that they gave to them in the hospital. That is not a professional license. That's not a professional certificate. As a nurse, you must get your professional license from Nursing and Midwifery Council. So a midwife is someone that has been trained and have gotten their license from Nursing and Midwifery Council. So they can provide care to any woman physically, emotionally, psychologically throughout birth period. That's a midwife. Then we go to the scope of midwifery. Scope of midwifery. The scope of midwifery has to do with almost everything we've been saying. The first thing that it has to do with the care of the woman during pregnancy. Care of the woman during pregnancy, antenatal. It has to do with care of the woman during labor and delivery. Intranatal, intranatal or intrapartum. The care of the woman after delivery, postnatal, postpartum or puerperium. Then it has to do with care of the newborn, mostly in terms of feeding, in terms of cord care, because many children get infections as a result of poor cord care. So care of the newborn, health education on nutrition, health education on personal hygiene, etc. Counseling these women on how to prepare for their pregnancy and for their delivery. They call it bed preparedness. Bed preparedness. We'll get to that stage. So you must counsel them concerning that, and you must give them family planning services. You can start it at antenatal. Tell them concerning family planning. When you are telling them concerning immunization for their children, also tell them concerning family planning, so they can plan their child spacing. Planning your child spacing does not mean that you want to stop giving birth or anything. No, it will help you as the mother to heal before you get pregnant again. It will also help your baby to see or enjoy you as the mother. Still enjoy that baby love before you give birth to another child. So you must give them family planning services. Then the last but not the least, it also helps in early detection and referral of complication. Early detection. Many hospitals, when you go for antenatal booking, you do a lot of tests. So they can know if you're having any infection that needs to be treated, If you are even having cancer, they will know, because they do cervical cancer screening for pregnant women. Where I registered, where I delivered, it's a must. You must do cervical cancer screening. So if a woman is having cervical cancer, after that screening, you can go for treatment. That's after delivery. Then it also helps for complications. When you take care of this woman during antenatal stage, once you see any complication, you refer to appropriate hospitals. We know there are 3 different categories of hospital: primary, secondary, and tertiary. You can be in a primary setting, but you need to refer this woman to either a secondary or tertiary hospital where they can take very good care of this woman. So that is all about the scope. Then we go to the objectives. Still same thing. Objective is just you promote the health of this woman and this child. Promote and maintain good health for them. Early detection of any complication. Early detection. Detect it early, because the earlier the better. When you can detect it early, treatment becomes easier. And also, it reduces maternal and infant morbidity and mortality. It reduces infant and maternal morbidity, that's disease, and mortality, that is death. It also helps to provide emotional support to these women, as well as psychological support to them, because many midwives, they have helped a lot of women get better emotionally and psychologically, because pregnancy is not an easy journey. It affects you physically, it affects you psychologically, affects you emotionally. So she encourages them, gives them counsel and ECT. Quality of a good midwife. Qualities of a good midwife. As a good midwife, you must have good communication skill. Good communication skills. Because you communicate with these women before their pregnancy, during labor, after pregnancy. You can also communicate with this woman and her husband or her family members when you want to perform a cesarean section for them. You need to communicate with them, tell them the advantages, the disadvantages. If you are not good in communicating, you will not be able to drive home the point of how important that emergency CS or that CS is to that patient. So you must have good communication skill, very important. Then the next thing, as a midwife, you must be patient and you must have empathy. You must be patient with these women. Like we say, pregnancy has a lot of hormones that they release during that pregnancy. And some women can become withdrawn, some can become aggressive, and so on. So you must be patient with them, mostly in the labor ward, where we hear women slapping the mothers and the rest. I know it can be tempting, because I've delivered a lot of women. It is very tempting, mostly when you see women that they want to kill their own child by themselves, and then you become angry. You're angry you're not just angry because of anything, but you're angry because the life of that baby is at stake. A woman that is supposed to push should be closing her leg and using her leg to be pressing the head of the baby, pushing the baby inside. Meanwhile, baby is supposed to be coming out. It is very tempting to beat them in labor ward, but as a midwife, you are a professional, you should not do that. Just be patient with them and be empathetic. Be patient with them. Then as a midwife, you must be competent. You must know your work. As a midwife, you must know your work. Professional competency, very, very important. You must know your work as a midwife. Respect, dignity, privacy. You must respect these women. Even if you are older than them, please respect them for who they are. If they say call me Mrs., call them Mrs. If they say don't call me Mrs., call me Ma, call them Ma. Respect these women. Uphold their dignity. And you must provide privacy. Very important. Privacy is very, very important, because privacy, they can sue you for it. They can sue you for it. So you must ensure privacy. Just like in every procedure you are doing, you say, I ensure privacy, I ensure privacy. You can ensure privacy by closing the window, closing the blinds. You can ensure privacy by using screen to screen the patients when you want to do some procedures in an open ward. But if it's a private ward, if they are patient relative and they tell them to excuse you, that's also part of privacy. Patient should excuse you while you are doing your procedure on the patient, even if it's vital sign. Privacy is very important. You can tell your patient relative to excuse you while you do your vital signs. So dignity, respect, privacy, very, very important. Ability to work under pressure. You should have the ability to work under pressure, because there are sometimes you can be the only midwife in a hospital. Some private hospitals, they don't have enough of staff, so you can be the only midwife there, and then you're in the labor ward trying to deliver a patient, and that patient comes in. How will you manage this patient? Sometimes you can bring the two of them together. You'll be working with this one, working with this one, looking for who and who. In that instance, you should try and be calm. You can use the patient relative around, maybe the mother and the rest. Do this, like for example, you empty urine and you need to pour it inside the toilet. You can tell patient relative, please pour this urine inside that toilet, because while you are going to pour that urine inside that toilet, you don't know if the baby will come out, if you are the only one. But I don't advise any hospital to put just one nurse or one midwife in the hospital. If you have just one midwife to run a shift in your hospital, please, that hospital should not be running. One midwife or one nurse cannot run a hospital at all. But we are seeing it every day, even here in Nigeria. Some private hospitals don't have nurses. Per shift, they will just have one nurse per shift. How? So as a nurse, no matter who you are, where you are, private setting, in government setting, please try as much as possible to work under pressure. You have that power and you can do it. Then the last but not the least, ethical and compassionate attitude. When they say ethical, whatever you are doing must be evidence-based. Must be evidence-based because you are a professional. It must be evidence-based. You don't just do practice for practice's sake. You do it because it is in the book. It has been written there that this is how you are supposed to do this thing and that thing. So as a nurse, you must uphold all the ethics of nursing while performing your job as a midwife. And you must be compassionate, like I said before. It is very, very important. Then we go to importance of midwifery. Midwifery is very important. Important to mother, important to child, important to the community as a whole, because it helps the mother and the child to be in good health before, during, and after delivery. It helps the society. It reduces mortality rate, reduces infants' deaths, it reduces maternal deaths, promotes breastfeeding, and it also helps the family as a whole. Also helps the family as a whole. So that's all concerning introduction to midwifery. This is our first topic. By God's grace, we'll be doing our next topic, and that will be on the female reproductive system. The female reproductive system. I'll also talk about the male reproductive system. So stay tuned and please subscribe for more videos. Invite your friends, invite your colleague. If you have any question, put it down on the comment section. I'll also be posting these videos on WhatsApp. I will post it on Facebook and on YouTube. Follow me, drop a comment. If you have any question, I'm going to give you answers to it, either by texting or by making a video for that. Thank you.